Now more than ever, it's so hard to access the healthcare system.
I can tell you several times, even in the last several months, I've had to run to an urgent care. And it was 3 hours of my time with a sick child in tow, basically complaining the whole entire time. It's a massive stress and strain on the parents.
What we've done is taken that concept of virtual care and we said, let's enhance it by making sure that we provide some in-person services that can be available at your local pharmacy. To remove all those headaches, we made it really straightforward, convenient, easy.
Welcome, everyone, to the PI Podcast. This is the Patient Advocacy Initiative Podcast. I'm your host, Dr. Asha Pai Bohannon. Super excited today to have a wonderful guest. He is a pharmacist executive with over a 17-year career focused on population health management, community pharmacy operations, and really creating a revolutionary pharmacy benefits company to improve chronic care for thousands of patients, to help them enrich their lives, and really just create a whole new setting in for patients as well as for independent community pharmacies. So fun fact about him is that he went to pharmacy school at the University of Florida and completed a managed care residency at Kaiser Permanente near San Francisco. So welcome, Dr. Vinay Patel, to the PI Podcast. We're really excited to have you here and just to share your vision for what we can do for patients as well as the community pharmacy community.
That's right. Thank you so much, Asha. It's an honor to be here in front of your audience. I know you've had many years of doing a podcast and building people that really want to find a way to do things differently in healthcare. And so it's an honor to be here.
Well, thank you for being here. So I just want to dive in. I know you have some really amazing solutions that we are collaborating on some things together with, and just to bring out to the community more benefit to the patient and more access to the patient. And so I'd love for you to start with the Care Connect platform that you have, and what does that look like, and explain what that is.
The feedback that we've gotten from patients is now more than ever, it's so hard to access the healthcare system. Getting to see your doctor, whether you're a mom with kids or you're, just someone who's new to the workforce and you just want to go get some medical care, getting in front of a doctor's office has been harder and harder. Getting to your doctor's offices, there's less doctors per capita in general around the country, and those doctors' offices are so much busier than they were, 5-10 years ago. A lot of doctors' offices have been bought up by health systems, and it's just made things so much harder to access medical care. And so what we built with MakoRx Care Connect is to find a way, an alternative way to see your doctor where it's what we call hybrid care. We're used to something called virtual care, and during COVID, where if you need to talk to a doctor, you just get them up on your phone and have a chat with them. And it was great for things that, may not need a visit, that you don't need to see a doctor in person for, something real quick. So what we've done is taken that concept of virtual care and we said, let's enhance it by making sure that we provide some in-person services that can be available some surprisingly at your local pharmacy. And so we've taken this platform, MakoRx Care Connect, plugged it into local pharmacies across the Triangle and across North Carolina to start. And we actually also have pharmacies that are new this month in Virginia and South Carolina to start. That says, hey, when I get sick or if I need something, don't just think about your doctor's office, think about other places to go get care. And when we think about urgent care, we think about, it's going to take a couple hours, take a half day off work. And I don't know how much it's going to cost me after I have my visit. I have to wait for a bill in the mail from the insurance company. To remove all those headaches, we made it really straightforward, convenient, easy for you to book an appointment, all cash prices on our website, and you go get those services like flu and strep testing at the pharmacy, which includes a telehealth consult with the doctor right at the pharmacy. So you could walk in sick, walk out with your medication, a medication refill consult as well at the pharmacy, and other additional services, urgent care like services available right at local pharmacies.
I absolutely love that. And when you talk about busy moms, like this is where I really want to focus this on, because I'm a busy mom. And I can tell you several times, even in the last several months, I've had to run to an urgent care, and it's not run. It's run to wait. It's hurry up and wait. And it was 3 hours of my time with a sick child in tow, basically complaining the whole entire time because we're sitting there. And it's a massive stress and strain on the parents that are having to deal with that. So just the idea of being able to walk into the local pharmacy, get things done, walk out with the script, because even with the urgent care, if we had a script, we had to then wait for the pharmacy to get it. And then we had to go to the pharmacy. And again, with a sick child in tow, like none of this works very well. So I love this concept. And, I know we are collaborating on working with local PTAs or parent teacher organizations in schools to help kind of foster this, because, if we can work together as a community to bring some more of these community pharmacies into this, gain easier access for us, I think that could just be such a great fit for everybody. It's a win-win-win in my opinion. So I'm really excited to hear that this is a possibility. So can you describe a little bit more about how this would work in a community pharmacy setting? What would happen with the patient? What does the process look like?
Let's take your classic example. We have a parent, mom, dad, whomever, that has a sick kid, and they know they're as parents always do, they know everything. And so, they typically know when their kid's sick with either, the flu or the strep. And so when it's something familiar like that, what the parent would do is go on to MakoRxCareConnect.com, find their service and find their local pharmacy, book their appointment whenever it's convenient for them to go into the pharmacy to get this service done and pay online. And then they walk into the pharmacy, they check in, the pharmacy staff will complete their flu or strep test either on themselves or their child, and they'll have a result within 15 or so minutes. They'll get a result whether they're positive or negative for the flu and or the strep. And once they get the result, they'll connect into, we have tablets that we provided all these pharmacies. They'll connect into the tablet we provided to submit those test results to the telehealth team, medical team. And they'll have a prescription sent to them, their account, within 10 minutes. And then once they get their prescription, they release it to the pharmacy, and then they get it filled, and they're in and out within, ideal visit, about an hour, a little bit less than an hour to be in and out with medication. And it's real straightforward. It's affordable because we've cut out all of these middle layers that exist in healthcare today. It just makes things so complicated, makes it so expensive. So not only affordable, but convenient when you just make it a direct relationship between the patient and this healthcare service that just happens to be provided at the pharmacy.
Love that. Love that. So music to my ears when you say an hour, because even when you're talking about going to the pediatrician or trying to set up an appointment with your own primary care, sometimes you can't get in when you need to get in.
That's right.
Not knocking any of those routes.
Exactly.
So if you want to go that way, absolutely. But this is just providing easier access, maybe a few more routes that we can use. There's a lot of people around. We need more access to healthcare. So I would love for you to talk about kind of that next layer for you too in the business. I'm going to let you take it away with that. So if you'll share a little bit more about affordable healthcare concept.
Yeah, absolutely. So this platform was built to work with local community pharmacies, and we'll talk to all of your wonderful patients and members that listen to this podcast and how they can help us recruit more pharmacies, which is key. But the platform was built now to start with, just sort of this point of care testing, which is flu and strep, and just say, okay, can we get people, does the model work with people desiring the service, needing it, finding it valuable, and accessing it? Yes, the answer was overwhelmingly. We've had over 300 appointments that we had over the last year, just when we started offering this last flu and winter season last year. And so overwhelmingly, people said, we want this service. We want you to find more pharmacies. We want you to find more services. So then we added the urgent care service to this platform. So we said, okay, look, anyone that's going in for an urgent care service that's not related to anything you can get a test for, if you're just feeling like you have a sinus infection or an earache or an eye infection or a stomach issue, need refills on your medications, we've added now what's called an urgent care option. So we moved from an individual test and treatment option to now sort of more of a generalized, something's wrong with me, I don't know what it is, or maybe I got a rash or a cut or something like that. It doesn't require it's not life-threatening, doesn't require you to go to the emergency room or actual urgent care. that can be managed in the pharmacy, we now have availability for those services to be booked at pharmacies. And then the next iteration, which will be coming out next year, is primary care. So think about going to your pharmacy to see your doctor and having a relationship with your doctor at the pharmacy. And this is really built around the concept of rural care, where it's just harder, even harder than people that live in urban, suburban areas to go see their doctor and have a relationship with the doctor. We just heard about a city down in southwest North Carolina that just lost their last primary care doctor in Mount Gilead, wow, North Carolina. And so they don't have access to primary care. And so this is where it's going next, where the tablet will serve as you book an appointment. Now you can just see have your regular doctor's office visit right at the pharmacy. And when the doctor says, I need you to go get a test from me, we need to check your blood pressure, or we need to check your cholesterol, you can then turn around and the pharmacy team will be there to do whatever you need in person. They could check your blood pressure, they can check your blood work or draw your blood to get blood results sent to the doctor's office. They could do basic imaging as well. And so these wraparound services, what we're calling the future of care, which is hybrid care, which is there's going to be some component that's virtual. Your doctor will be available whenever you need them through a digital telehealth solution. And then whatever you need in person, most of those things could be done right there at the pharmacy. And then, hey, you just happen to be at the pharmacy, you can get your prescriptions there too. And so this is really the holistic sort of care that we could provide people that now have a new relationship with the doctor that's virtual. But it's the same doctor you get to see every time, but now, there's more access to your point.
Oh, I love the hybrid care option for people because I think, for all the bad things that COVID brought, I think this is an amazing piece, positive piece to this, which is, it's opened up access and care and the idea around healthcare and how we can actually provide more and better care for people across the board. I love that it's in the pharmacy setting. Obviously, we're both pharmacists. And so this idea of holistic care, of a holistic plan in place to really help the patient from end to end.
That's right.
And, a lot of the primary care visits are related to picking up medications or refills or whatever it is. And so to be able to do that at the place that you're going to go anyway, it just makes more sense. So it actually helps a lot of people in that way. You and I are going to get on another podcast for sure and talk about how this is going to benefit the actual community pharmacies as well. I think this is a really great point. So we'll have a whole other podcast for community pharmacies, particular independent community pharmacies. And how this is going to benefit you and your resources as well at a future episode. But for now, I definitely want to let everybody know that we have all of the information for MakoRx and this Care Connect platform and ways to get in touch with MakoRx, as well as myself. If you want to learn more about it, get involved. If you know of a community pharmacy that maybe wants to participate, if you know of a PTA that wants to participate in our affiliate program with it, I think those are all amazing ways to connect with us. And I will have all of that information in the show notes. And so I always like to end our podcast episodes with just one thing that you want. If there's one thing that somebody takes away from the message here today, would that be for you?
That is a very special question, Asha. If I had to pick one thing to tell your members, your audience, your patients, I know you call them lots of different things, but as pharmacists, we treat everyone as a patient, is when you check out the information that's available in the show notes, as Asha mentioned, and you want this at your local pharmacy, walk into your local community pharmacy and ask to speak to the pharmacist or the owner and say, we'd love for you to offer this service. And just ask them to reach out to us. It's that simple. It takes less than 10 minutes to activate a pharmacy and get them started. And it takes less than a week to get them all the things to get started. So it's real quick, real easy. It's not a heavy lift for the pharmacy. I know they're really busy taking care of lots of people in their community and all the work that pharmacy has to do. Is don't want to belittle that at all. But I'd encourage every single one of your listeners to go into their local community pharmacy and ask them if they're interested, they see value in this, to offer it in their communities by simply reaching out to us. That's all they need to do.
That's fantastic. Thank you so much. I really just admire and appreciate the amount of care that you put into bringing more access to healthcare for our patients and our surrounding communities. So thank you for being here. We will definitely be continuing the conversation in the months to come. But thank you again for being here.